So we look at another rare phenomenon or rare condition which is not really studied at large. This is what is known as the general paralysis of the insane. Alright? General paralysis of the insane, So it's also known as general paresis. It's also known as paralytic dementia. It's also known as syphilitic paresis. Please take note of those names because they can switch them anytime, any day. Alright, so it's also severe neuropsychiatric disorder. It's caused by late stage untreated syphilis. So this person had syphilis, alright, then they didn't treat it very well, so it went to the late stage. You understand? So it results from chronic inflammation of the brain by the organism that causes syphilis. Chronic means it has been there for a long time. So it leads to progressive meningoencephalitis and cerebral atrophy. Okay, so what happens in this general paralysis of the insane? So syphilis bacterium has been there in your system for a very long time. They now crossed boundaries to the central nervous system. Alright, and this is after many years. You had syphilis, you didn't treat it well. Alright, so chronic inflammation will damage the frontal and the temporal lobes, affecting how you see, affecting how you behave, affecting how you can be able to control your muscles and all. So symptoms typically appear 10 to 30 years after infection. So it's a chronic disorder. Alright, so symptoms is the person is tired, headaches, insomnia, that's early symptoms, dizziness, subtle personality changes. Alright, then later on you have cognitive decline where the person is having memory loss, poor judgment, is confused, not oriented. Psychiatric issues like the person is becoming delusional, mania, depression, so motor issues like your body's now shaking and all of that, gait disturbances, seizures. So late issues like severe dementia, mutism, incontinence, cachexia, bedridden states. So diagnosis, serology just to determine the syphilis, CSF analysis because you want to see that there's a central nervous system infection, alright, of the Treponema pallidum. That's neurosyphilis. And neuroimaging, just to show that the brain is eating away, that's atrophy and all of that. Treatment is penicillin G. Alright, you can also add other drugs like ceftriaxone, doxycycline. Then if there's inflammation, you bring corticosteroids there and all of that. Okay, so for the symptomatic care, you can use antipsychotic drugs if the person is having psychosis, anticonvulsants, then physical therapy. Alright, so this is just what the general paralysis of the insane means as a concept.